It's been interesting because for the first time in my career, probably 15 years, we're seeing a transition where hospital systems are looking out and planning for much longer window periods. We see it as much strategic focus on 20 to 50 years now. And I think a lot of this is because of the anticipated demand that we're going to have from the Affordable Care Act, however that gets proposed and implemented. And then also with probably the biggest wave is going to be the baby boomer cycle and the demands that it's going to put on healthcare. So it's a change in philosophies now, and we're seeing that they're also very focused on acquiring as many physician groups, independent physicians and mid-sized clinic groups, to put them under their umbrella to be competitive, to deliver the best health care possible in the county, and then also to control costs. I think they can get more physicians and more medical groups under their umbrella. It allows them to have some efficiencies that make them more competitive in a very competitive market.
There are really three big factors that are driving healthcare real estate demand in San Diego and throughout the nation, and those are the impact of healthcare reform, which affects everybody a little bit differently, the growing population of senior citizens, which is driven by the aging baby boomer population, and the advancements in technology and outpatient care, which is causing more hospitals and requiring more hospitals to push more procedures off their hospital campuses and into outpatient medical office buildings in the community. And the end result of all that is increased and steady activity in the marketplace.
The differentiators in this market for us, from a healthcare perspective, is that it's one of the most unique markets in the entire country, primarily because the 6 hospitals that really perform most of the care in the county are all headquartered here and local and provide their care exclusively in this county. They're all non-for-profit systems, and it makes it very difficult for outside competition to come into our market. It helps us because those providers really are focused exclusively of trying to deliver the best care in San Diego County in a very competitive market. It also helps us because now we know who the systems are, the players, what their goals are, where they're looking for real estate opportunities, and it allows us to be probably more focused in a very specific region.
Well, now is a critical time for health systems to take a close look at their occupancy costs, which is usually about the 4th line item on their P&L. There are strategic ways that large providers can centralize and standardize all the areas in which they're spending money on their occupancy costs. So large health systems are looking to firms like Jones Lang LaSalle to assist with this optimization. We're also advising large providers and health systems to really think about whether they should be leasing, acquiring, developing, or building real estate, healthcare real estate, as each individual health system or large provider and even small providers have different needs in terms of their target population, how critical is flexibility to them, and the best sources of the best uses of resources and capital. So acquiring, leasing, renewing, developing, building all have a different impact and take different things into consideration, and now is the perfect time to analyze that.